Yeah, precision medicine is about, I guess, personalizing treatment, and now that we have some targets to identify, so claudin is one, HER2 was the first one, a deficient mismatch repair for immunotherapy is another one, and there are other targets, fibroblast growth factor receptor, which for drugs in development and in trials for. So I think over the course of the next year, we'll have several targets that we can look for to try to select patient therapies. Of course, you need a trial that's proven to benefit in that. So we have HER2 targeted therapies. We now have the claudin, FGFR trials are in progress, and DMMR has been out for a while. That's deficient mismatch repair, so microsatellite instability. So more work needs to be done because they're not the only things, but we also need drugs to target these. So I think nowadays, if I have a new patient, I will look for those things for which we have drugs available.